our topic is a blood pressure. Blood pressure is basically why there is a pressure in the blood, because it to maintain the flow of blood from aorta to capillaries. Like why the pressure is generated in the blood, because to maintain the flow of blood from aorta to the capillaries. Here what is mean by the blood pressure, like the blood pressure is exerted against the walls of arteries. Generally we are talking about blood vessels, but specifically if we specify, that is arteries. So the blood pressure is basically exerted against the walls of the arteries, and the pressure is generated by the pumping organ. The pressure is generated by the pumping organ. If we talk about the highest blood pressure, that is generated where? That is generated in aorta. Highest blood pressure, that is in aorta. So the blood pressure is detected by an instrument, and that instrument is sphygmomanometer. Okay, that is the instrument through which we are detecting the blood pressure. And now there is like two types of pressure. One is systolic pressure. Systolic pressure means when the ventricles will contract, the pressure is generated. Here the pressure is generated and the blood moves from the ventricle to the aorta, and that pressure is generated, that is normally, if we talk about normal, that is 120 mm of Hg, the systolic pressure. If we talk about the systolic pressure, then if we talk about the diastolic pressure, that pressure is generated when ventricles relax. That pressure is because the ventricle are relaxed here, so no pressure is generated here. So the pressure will get down, and it will be like maximum 80 mm of Hg. That is like a value, but it like varies from person to person, but that is a normal diastolic pressure, and that is the systolic pressure, that is 120 mm of Hg. Now if we talk about the pulse here, like pulse is like if a force is generated, if the force is generated, like pressure is generated in the arteries. As I said, the highest blood pressure is in aorta. So if we take about arteries, like because aorta is divided into arteries, then if the pressure is generated more in arteries, okay, so the arteries will get wider, because the more pressure is generated, so arteries will get wider, that will be vasodilation. And if the less pressure is generated here in the arteries, so the arteries will get narrower, that will be vasoconstriction, as we have discussed earlier as well. So that vasodilation and vasoconstriction, that changes in arteries, is known as pulse, because as the pressure is generated, as the pressure increases, like the force increases, so the flow of blood will increase. That is directly proportional to each other. When the force is increased, so the flow will be increased. as the force will get reduced, like for the pressure get reduced, the flow will get reduced. And if we talk about the pressure gradient, as we are familiar with the concentration gradient, like from high, that is from the higher concentration to the lower concentration, as similar here we are using the pressure gradient, that is the pressure from the higher pressure move from the higher concentration to the lower concentration. Here it is applicable from aorta, because the higher pressure is in aorta, to the arteries, then arteries to the arterioles to the capillaries and all that. So basically the pressure here also, it will be from higher concentration to the lower concentration, from aorta to the arteries, and arteries to the arterioles, and arterioles to the capillaries and all that. So here pressure gradient is used, the name is used like pressure gradient, that is from the pressure will move from the higher concentration to the lower concentration. As I said that the pressure is more in aorta, the pressure is more in aorta. So as the blood move away from the heart slowly, gradually, the pressure will get decrease. The pressure decreases. Why the pressure is decreasing? That's a question, that why the pressure is decreasing? Because of the friction, like the friction between the walls and capillaries, to that so that is why the pressure is decreased, as the blood is blood moves away from the heart. But again the pressure is generated in the veins. Now how? Because as I said, veins pressure increases because of the surrounding muscles. As veins are surrounded by the muscles, so the muscles will generate the pressure. But we do not detect the pressure of veins, but we detect the pressure of arteries from the sphygmomanometer. So that is why the pressure increase in the veins because of the surrounded muscles. Now if we talk about this graph, basically as I said, the 60 to 80, that is mm of Hg, the pressure of diastolic pressure, that is systolic pressure, that is 120. Now the more pressure is in aorta, so as the more pressure is in aorta, so the pressure will move from the higher concentration to the lower concentration. So it is moving, the pressure is moving, and slowly, gradually, it will the pressure is reducing, then arteries it will reduce, then capillaries, veins, values it will reduce, then again it is getting reduced till here it is reduced. Now after capillaries, now again the pressure is generated in the veins, not as much as aorta, but the pressure is generated. Then again the pressure will reduce in the when it reaches to the vena cava. So force decreases, the pressure decreases again, as here in the veins the pressure increases, but as it again move into the vena cava, the pressure again decreases. So that is the graph of blood pressure, that we can understand that is the pressure gradient as well, that the pressure is moving from a higher concentration to the lower concentration.